had one nurse who really did not want to respect that. She's like, I need to check heart rate. Nothing was wrong. Birth was going great. And that nurse really disrespected my boundaries, ended up touching me, and then I punched her.
This situation was one in which this lady was given birth and she had a birth plan in place and she wanted it followed, which is completely understandable. But in her plan, she didn't really want to be touched much or talked to. And one of the nurses was trying to check the baby's heart rate. And in doing so, of course, she had to touch the mother. The mother felt like the nurse was ignoring her boundaries, and the mother punched the nurse. Okay. And from my understanding as well, this mother had lost a baby before, and she felt like it was lack of attention to the details that led to the loss of the other baby. So here she's in a situation giving birth now to a new baby, and the nurse is trying to make sure the baby is okay. When it comes to delivering babies, the mother is not the only patient, the baby is a patient also. I honestly feel that that nurse had no bad intention. She was just doing her job. If something had happened to this woman's baby, and let's say the baby didn't make it, that nurse would have been one of the people who were held accountable. Because even though the mom said she didn't want to be touched, the attorneys would have found some kind of way to say, but you as a professional who knew better, you knew the baby was in danger. You should have had the knowledge and experience to say, no, this baby's in danger. I'm telling you, they would have found some way to turn this around on that nurse and that hospital. So it's a touchy situation that the nurse is put in. You do have to respect patients and you do have to respect their boundaries. And for me, the way I do that is documentation, documentation, documentation. Did you document every time I came next to the patient or tried to do such and such, patient became aggressive or patient was agitated? Patient refused. It's documented. And not only that, I would specify that patient refuses despite being advised of the risk. That mother had no right punching a nurse. None at all. Let's turn it around on the other side. Had that been a healthcare professional who'd gotten so frustrated, even if it was warranted, because there are people now who will get up in our faces and who are very aggressive. If we were to dare punch them because they breached our boundaries, you best believe we would get fired or have some other repercussions or get sued or something. And my problem with this situation is that you see more and more people who are acting out against healthcare workers. And again, I've been in the field for a long time, and people have always pushed boundaries, and people always upset, frustrated, and it's something that we deal with on a constant basis. And don't tell me that it's what we signed up for, because in none of my contracts did it say that I signed up to be punched or talked to a certain way and all that. So again, we see it and we've had to deal with it. Since COVID, in the last few years, people have gotten so aggressive against healthcare providers and nurses. People will go online and they see people like this influencer. It looks like she has about 2 million followers. You have people who are on this person's side who think it's okay to do what she did and they're justifying her actions. And these same followers or people who see this may think it's okay to come into a healthcare facility and punch a healthcare provider or a nurse because they saw it online. Don't think because you saw this online to come do this in real life, because the outcome may be completely different, because there are nurses out there who will punch you back. And number two, there are people who will file charges against you, or you will get discharged from the practice. And not only that, people don't understand that you keep having this antagonism against healthcare professionals. Who's going to take care of you when you get sick? Nurses and healthcare professionals are leaving in droves